ద్వారా మన తెలుగోడి ఐక్యాన్ని చాట వాషింగ్టన్ డీసీ వీధులు పోటెత్తాలిరా లోకం తెలుగోడి ఖ్యాతిని జై కొట్టాలిరా కష్టాలు వచ్చినా కన్నీళ్లు వచ్చినా భుజాలు తట్టనేస్తమే సభలకు వచ్చినా వితరణనిచ్చినా ఆ మాతృమట్టి కోసమే 90లోనే బీజం వేసి చెట్టైంది ఇవ్వాలిరా ఎన్నారైలా చీకట్లలో పెట్టింది దీపాలిగా తెలుగు సంస్కృతికే అన్నై హోరెత్తిందిరా వాషింగ్టన్ డీసీ వీధులు పోటెత్తాలిరా లోకం తెలుగోడి ఖ్యాతిని జై కొట్టాలిరా
ఆకాశమే అక్కై అలరించే ఈ వేదిక ప్రతివారికి ఆహ్వానమంతమే రండిగా
కళల వైభవం యువత ప్రాభవం ఆట మహోత్సవం జరాలి అందరం చూడాలి సుందరం రెండేళ్ల కోసం భరం విచ్చేసిన తారాలోకం వినోద విన్యాసాలు వచ్చేసిన ప్రతిభకు ఇచ్చే సన్మాన ప్రోత్సాహాలు తెలుగు ఐక్యతకి ఆట చేసే వ్రతం చూడ పలికింది నీకు సుస్వాగతం వాషింగ్టన్ డీసీ వాషింగ్టన్ డీసీ వాషింగ్టన్ డీసీ వీధులు పోటెత్తాలిరా లోకం తెలుగోడి ఖ్యాతిని జై కొట్టాలిరా కొట్టాలిరా.
Hello everyone. First of all, I would like to thank ABR Productions and American Telugu Association for making this program possible to worldwide people aware of the what sudden cardiac death is and how to prevent this sudden cardiac death, especially in younger individuals who are every day dying of this problem with a sudden cardiac death. First, let's talk about what is sudden cardiac death. Sudden cardiac death is a sudden unexpected death of the person due to loss of heart function. So why would this happen? So what are the causes? So we'll discuss today also how to prevent and what are the risk factors. So we'll go one by one how to manage this problem to prevent it and how to treat it if somebody goes through the sudden cardiac death. Majority of the time sudden cardiac death is because of heart muscle being damaged by a prior myocardial infarction or what we call a heart attack that causes the heart to damage and causes the scar tissue. Scar tissue can produce a erratic, dysfunctional, disorganized, irregular rhythm called ventricular fibrillation, which causes the person to go into losing consciousness and which causes the sudden cardiac death. About 80% of the time sudden cardiac death is caused by people who have heart disease with a coronary artery disease, which is a blockage in the heart arteries which causes the heart to not to get enough blood flow. As I said, 75% of the time it's a prior heart attack, but about 5 to 10% of the time people don't have a heart attack prior, but first presentation of a heart attack could be a sudden cardiac death. So that's how you see a lot of people never had any problems, exercise regularly, but suddenly drop dead or come in with a heart attack. So why does this happen? There is a misconception that people think you need to have a 70 or 80% blockage to have a heart attack. That's not true. So even if you have a 20, 30 or 40% blockage, people can get the heart attacks because of a condition or a situation called a plaque rupture. Blockage is only 20%, 30%, which is not detectable by our regular stress test. But suddenly a 20, 30, 40% plaque can rupture and form a blood clot, which can cause the heart muscle to die suddenly within 5 to 10 minutes. When the heart muscle starts to die, that causes this irregular rhythm called ventricular fibrillation, and which causes the sudden death. There are other conditions also which can cause the sudden cardiac death, like what we call a dilated cardiomyopathy, which is a weak heart muscle caused by either a viral infection or some other conditions, and about 15 to 20% of the time there is a familial dilated cardiomyopathy which runs in the families. And there are also some people are born with abnormal rhythm conditions called prolonged QT or long QT syndrome or WPW syndrome or heart blocks, which also can cause this sudden cardiac death risk increase in that particular group of people. And even somebody who has normal heart, if their potassium or magnesium levels can dramatically change, and that can trigger these kind of arrhythmias called ventricular fibrillation. So if you have obesity, tobacco use, diabetes, IV or recreational drug use, all of those could potentially increase the risk of sudden death. So I think we need to take care of the risk factors by lifestyle changes so that we can decrease the risk of the sudden death. So other causes, especially in younger people for sudden cardiac death, could be because of hypertrophic cardiomyopathy, which is a special thickening of the heart muscle which predisposes the people to get these arrhythmias and which can cause the sudden cardiac death. So all athletes or people who are heavily exercising should get a physician consultation before they start the program. So with good history, with a good exam, and if needed more testing can detect all these problems with the risk factors for sudden cardiac death can be detected. So I think it's important for people to have their risk factors identified and get the checkup done so that we can decrease the risk of sudden cardiac death. Sudden cardiac death occurs mostly in young people less than 50 years of age. As we get older, the risk of sudden cardiac death goes down, and more people present with a heart attack, not having a sudden cardiac death as the initial presentation. Sudden cardiac death is the most common cause of natural death in the world. About 350,000 people die of sudden cardiac death every year. About 1 in 100 to 150,000 people, especially in children, can also have sudden cardiac death. Mostly it's because of a congenital heart condition. If they are born with a congenital heart disease, which can predispose them either during the condition, because of the condition, or if they had the surgery done, and surgery can lead to some arrhythmias because of the scar tissue. So sudden cardiac death is the most common cause of natural death in adults in the United States. About 300 to 350,000 people die of sudden cardiac death every year in the United States. Most of these are because of the coronary artery disease. So how do we decrease or prevent the sudden cardiac death? So the main risk factor is the coronary artery disease. So by decreasing the risk factors for the coronary artery disease, like controlling the diabetes, controlling the hypertension, and decreasing the cholesterol, doing exercise regularly and following a low-fat diet, and avoidance of tobacco, and then use of medications when needed and as treated by the physician will help to detect and decrease the risk of the heart disease. There are tests physicians can do to detect all these risk factors. For example, men after 40, women after 50, if they can get the physical done on a regular basis so that we can detect these risk factors, and if there is a blockage, we can detect by either doing a stress test, by doing the EKGs regularly to find some of these rare congenital heart conditions. And also there is a thing called coronary calcium score or CT angiography, where we can see the blockages even when they are less than 70%, so that we can treat the risk factors more aggressively to decrease the risk of the sudden cardiac death. So regarding the sudden cardiac death, can we prevent it? Can we treat it? So sudden cardiac death, because of the risk factors and the coronary artery disease, so if somebody had a heart attack and if somebody had a heart muscle damage, Now we have devices over the last few decades where defibrillator can be implanted in people who are at a higher risk of sudden death when their heart muscle function is weak, what we call an ejection fraction, which is how the heart muscle pumps. When it goes down less than 35%, we can put a small device in the chest which monitors the heart on a regular basis and give the shock when person needs within few seconds so that that person can be saved from the ventricular fibrillation. But also treating the cause for the coronary artery disease. If there are blockages, treating with the medications, putting the stents or doing the bypass surgeries will decrease the chance of having the symptoms and will chance of causing the heart attack and prolongs the survival by doing the treatments on a regular basis. The main key for treatment is in sudden cardiac death setting is calling for help. Call 911 first and then start CPR, and then if there is a defibrillator available, try to see if we can use the defibrillator to identify the rhythm, if it is a shockable or not. That will save lives. If the treatment is started within few minutes, chance of survival is about 90%. But every minute delay in the treatment decreases the chance of survival by 10%. That's where we all need to learn how to do the CPR, how to call for help, especially in people who have high risk factors, family and friends. Knowing the treatment options, especially the basic life support system with CPR. I think Dr. Garimella now is going to talk about how we can do the CPR, how we can learn about these basic life support system techniques so that we can prevent the sudden cardiac death, and even if somebody gets the sudden cardiac death, we can prolong their survival time and increasing the survival by doing the treatment at home while waiting for the EMS. I wish everyone healthy, happy holiday season and have a good risk factor reduction so that we can have a good, healthy, quality life. Thank you. Hello everyone. First of all, I would like to thank ABR Productions and American Telugu Association for making this program possible to worldwide people aware of what sudden cardiac death is and how to prevent this sudden cardiac death, especially in younger individuals who are every day dying of this problem with a sudden cardiac death. Yeah. Now I would like to introduce Dr. Prasad Garimella, who is a well-known pulmonologist and a critical care and a sleep medicine specialist, and also past chief of medicine at Northside Hospital, to talk about what the life support, how we can learn the CPR, and how we can make the life prolonged and save from the sudden cardiac death in these high-risk patients.
Thank you, Dr. Gangasani, for the wonderful introduction. Thanks to American Telugu Association and ABR Productions. I'm Prasad Garimella. I'm a pulmonary critical care and sleep medicine specialist. So today's talk, I want to talk about the CPR, BLS. CPR is cardiopulmonary resuscitation. It's same thing as BLS or basic life support. What is CPR? Why we need to do it, how we need to do it, who we need to do it is what we're going to discuss today. Before we go to the CPR, let's see what happens when the patient needs the CPR. The heart, the lungs, and the brain, those work in parallel to maintain the life. So if the heart is not working, you are not going to have the pulse. If the lungs are not going to work, if they are not working, the breath, they will have shortness of breath or they are not breathing. If the brain is not working, they are unresponsive. So CPR, a simple way to remember what to do is instead of panic, instead of fear, you need to do ACT. ACT is the mnemonic, easy to remember. A, C, and T. A stands for assessment, C stands for call, T stands for treat. So let's go through these three things. Number one, A. We already talked about these three organs. So when you're trying to assess the patient whether they need the CPR or not, you are assessing the brain, the heart, and the lungs. So for the brain, if the patient is unresponsive, you're going to test whether the patient is responsive or not. So if this patient is unresponsive, you're going to test that. You tap on their shoulder above the clavicle and ask, "Are you okay?" If they don't respond or they are in distress, you need to consider doing the chest compressions if there is no pulse. So that is assessing the brain function. Next, you are going to check for the pulse. In adults, you check the carotid pulse. So how do you know where the carotid is? So you feel the windpipe. The windpipe is in front of the neck. So to the side of the windpipe, you can feel the pulse. That's the carotid artery. That's where you feel the pulse. Then you listen and see if they are breathing or not. So that's how you assess the brain, heart, and the lungs. If the patient is not having the pulse, if they are not responsive, and if they are not breathing, that means that they need CPR or BLS. The assessment should take only less than 10 seconds. You don't want to spend a lot of time assessing the patient. Next, we are going to move to C. C for call. So if you assess the patient and the patient needs help, immediately ask for help. So if you are in the hospital, you call for code blue. If you are outside, you ask for help, nearby person. And not only asking them for help, you also tell them at the same time if there is a defibrillator to bring the defibrillator. If nobody is there, or you can ask somebody to call emergency response team. So that is C. So it's very important, depending on the situation, you immediately call for help and also request for defibrillator, or take your own phone and call the emergency response system. That is very important before you start treating the patient. So the third aspect is treat. So treat involves assessing 4 things. One is obviously chest compressions. Number 2 is defibrillation. Number 3 is airway. Number 4 is breathing. These are the 4 things you need to assess to support the cardiopulmonary system so that the blood is continuing to the brain. Chest compressions. So where do you place the hand? How much you do, how fast you do is all you need to know. So in an adult patient, you need to find the breastbone or the sternum. So the bottom portion of the breastbone is called the xiphoid process. So one way you feel is like you follow the ribs, the bottom portion of the ribs, and then in the center, just above that, is the xiphoid process. The other thing is to follow the nipple line. If they are not obese, you can follow the nipple line, and in the center, you put the palm of your hand and you lock it. And then make sure that your hand, elbows, and shoulder are straight, and you do the chest compressions. So the important thing is to give 100 to 120 beats per minute. So that is the critical part. So by doing those chest compressions, you are pumping the heart that is not working. So that way you are establishing the circulation going to the rest of the body. How deep you do? In adults, you do at least 2 inches. Effective cardiopulmonary resuscitation is what is going to save the patient, and that is why very important to learn the skill, and you could save someone's life in danger. So we talked about where you place it, how you place it, how deep you do it too, and the most important thing is to let recoil. So if you do not let that recoil to occur, the heart is not filling up with the blood again. So that's why it is very important that you do the chest compressions and let go, and then do the chest compressions again. So when you do it 100 to 120 times per minute, that is the rate that you do, that's the depth that you need to do. So that's about the chest compressions. Next step you need to know is defibrillator. So the defibrillation, like Dr. Gangasani was saying earlier, sudden cardiac death, if the patient has ventricular fibrillation, one of the most common causes for sudden cardiac death, you need to shock the patient. So by shocking the patient, you're bringing them back into the rhythm. So the defibrillators are available in public places, especially airports and other places. So once the defibrillator is available, you switch it on first, and then you put the pads on the patient. There are two pads. You pass one in the right side front and then one on the side. So the point is, between these two pads, the electricity is conducted, so that electricity is going through the heart, so to re-establish a stable rhythm of the heart. So the placement of them, the switching it on so that you are not wasting time, and you need to analyze. Once you press that analyze button, you do not do the chest compressions. So that, by doing the chest compressions, you are going to create some rhythm, some electricity. So you do not touch the patient, you analyze, and if it is a shockable rhythm, the defibrillator will give a video audio prompt. If the shock is required, it is going to ask you to shock the patient. At that time, you charge and then shock. Before you do that, press the button to give the shock to the patient. You need to clear and make sure that everything is safe. Everybody is safe. So, and then once that shock is delivered, then you resume the chest compressions. So that is defibrillation. So this is an important life-giving skill, life-saving skill that everybody will be proud of for having that learned, mastered. That's number 2, is the defibrillation. The third aspect is the airway, especially in restaurants or children. There could be a choking. The airway is basically, it starts in the nose and the mouth. The air is following back of the nose, back of the throat, and then going through the windpipe into the lungs. If there is any blockage to the airway, the air in the atmosphere is not reaching the lungs. So it is very important to establish the airway. So simple things are, you make sure if they are not breathing well, do a chin lift. So you push on the chin so that the trachea or the windpipe is going to be straightened. Then the other thing, if there is a neck injury suspected, you do the jaw thrust. So by the side of the jaw, lower jaw or mandible, you push the lower jaw or mandible forward. So that way you establish the airway. So the other scenario that you could encounter is a choking victim. Choking victim, somebody swallowed while eating, the food particle has entered the wrong pipe. So there's a food pipe in the back, there's a windpipe in the front. If the food is going into the wrong side, into the front, into the windpipe, so they suddenly don't have any air reaching the lung, obviously that's going to shut down the cardiopulmonary system. So you need to consider doing Heimlich Maneuver in those patients. In an adult patient, you do the Heimlich Maneuver by putting your locked wrists from behind, and then give the compression, chest compression. By doing those chest compressions, you are creating that positive pressure which will dislodge that foreign body from the food particle or the foreign body from the windpipe. That's how you can immediately save. So Dr. Heimlich, who invented this many years ago, and when he was at 97 years of age, he happened to have a person in the restaurant, and he saved somebody at 97. So that's called the Heimlich Maneuver, and that's for the adults. For children, infants, and neonates, those maneuvers to dislodge the foreign body are different. That's why I strongly recommend that all of you take a certification in basic life support. It is as important as you drive and get a driver's license. And finally, last one is the ventilation. in this COVID pandemic era, it is not advisable to do the mouth-to-mouth breathing, but if you have an advanced airway, or if you have a mask, a face mask or non-rebreather mask that you can provide safely with oxygen source, you should give 2 breaths for every 30 chest compressions. So that's the ratio that you follow. You don't want to give too much of ventilation because that has its own downside to a patient who is already critical. These are the 4 things that you assess in the treat. So the victim, the person who needs the CPR, could be a neonate. Neonate is first from birth to 4 weeks, 28 days. Infant is from 28 days of age to 1 year is infant. A child is 1 year to puberty. And from puberty to 18 years of age is adolescent. And then after 18 is obviously adult. So the CPR is different for different ages. Obviously, the needs are different. The rates with which you give the support are going to be different. That is why it is essential for people to know the basic life support certification. Another important thing you need to know is when to stop the chest compressions. If the patient has recovery, the goal of CPR is spontaneous return of circulation. How do you know that patient has spontaneous circulation? Is by feeling the pulse. So if the patient has a pulse, or he has responsiveness, or he started to move, or he started to breathe, or by advanced CO2 monitoring and other devices, you can measure whether the patient has spontaneous return of circulation or not. So if the patient has spontaneous return of circulation, or a medical professional physician has asked to stop the chest compressions, until that time it is recommended to continue the CPR. So the goals of CPR are that it is safe, number 1. Number 2 is it is effective, and number 3 is spontaneous return of circulation. So it has to be safe for you, for the patient, and people around you. You don't want to do the chest compressions in a busy road. You got to move the patient to a place where it is safe for you and for him. You want to make sure patient is not wet in the front before you put on the defibrillation and give the shocks. These are safety features you need to think about. The another, with the pandemic, it is very important that you consider the possible COVID status of the patient. That is not discouraging you to do the chest compressions, but take all the precautions possible to save a life. Effective. Effective means that you know what you are doing. Instead of paralyzed by the fear, knowledge is power. You know the knowledge of how to give the life to the patient when it is needed, and the skill that is mastered is going to save the patient. Every minute that is lost is going to decrease the chance of survival by 10%. I want to reiterate what Dr. Gangasani mentioned earlier about this. Time is so crucial here. And the third one is spontaneous return of circulation is the third goal of CPR, or basic life support. There are many areas, colleges, the heart associations, medical associations who are providing this excellent certification. So like I said earlier, it is as important as you have a driver's license to have a BLS. You could save lives. And don't forget ACT. Assess, call, and treat. Go save lives. Thank you.
లెగరా మనకాహ్వానమంటోంది ఆట, వదరా మన తెలుగోడి ఐక్యాన్ని చాట. కష్టాలు వచ్చినా కన్నీళ్లు వచ్చినా భుజాలు తట్టనేస్తమే. సభలకు వచ్చిన వితరణనిచ్చిన ఆ మాతృమట్టి కోసమే. 90లో